Hi, caregivers. Thanks so much for joining us today. On a Friday to get some updated information and about some new changes that may be happening. Um, as you know, the CDC guidelines and orders from the health department are changing every day. Uh, and our goal is to keep you well informed about the changes that are happening and hopefully answer some of your questions and concerns as we have these videos. This just seemed much easier and more personal than to send a really, really long text. Many of you have heard major cities in the state of California have gone to shelter-in-place orders over the last few days. The only exception to this order is for essential personnel. Essential personnel are people like doctors, nurses, police officers, people that keep society functioning right now. One of the jobs considered essential personnel is that of a caregiver. As caregivers, we are still required to be out and about, maintain the continuation of care for our clients. And as I mentioned in the first video that you saw, our clients need us more now than ever, and we may be the only resource they have through this difficult time. We want you to know how much we acknowledge the importance of the work you're doing. We really appreciate what you're doing. We hope you realize the important difference you're making in someone's life. We also know this is a very hard time for all of you. You may have people in your household that aren't working or have been laid off, and so they're not bringing in that income. We know that everybody's very stressed. Children are home. There's additional costs. There's all kinds of things happening. So we decided to try to do what we can to help. One of the ways we're going to try is we will temporarily be paying bonuses based upon the number of hours that you worked out to caregivers just for a time frame now to help you get through this. We don't know how long we'll continue to do that. We'll let you know before they stop. But for now, we're going to try to continue that for a while to help you. As essential personnel, you will be going into your clients to help them through the day. We are responsible to help flatten the curve of coronavirus as an essential personnel. Flattening the curve, you've heard that probably a lot. You've probably heard, if you've watched any of the news conferences by Governor DeWine and Dr. Acton, you've probably heard that a lot. Flattening the curve refers to containing the spread of the virus as much as possible. What this means, so people that get infected, we don't want there to be a huge spike like this of people that are going into the hospital and overrunning the hospitals. Instead, what we want is a steady, kind of an easy hill that will make it possible for everyone to have the supplies, the professionals, the medical care that they need. We don't want the hospitals getting overwhelmed at this point. This is why self-isolation or sheltering at home practices are in place, except for essential personnel like ourselves. I want to reassure you that the more people that practice shelter in place, the safer you are as essential personnel traveling from client to client and interacting, because you aren't going to have as much exposure. Since we are essential personnel and we will be going to work, there are a few things you can do to help flatten the curve yourself. First, every time you enter a client's home, and we talked about this earlier, in addition to washing your hands, wash all the surfaces, the hard surfaces, the counters, the tables. Wash the TV remote. That's a huge one. The toilet bowl handles, the doorknobs, light fixtures, anything that they might have touched. I mean, and your clients, where they go in the house, and what they touch a lot. Do this if you have disinfectant. If you don't have disinfectant, because I know it's hard to find right now, hot water and soap is better than nothing. Okay. You should also be doing this at your own home on a regular basis. The other thing you can do is refrain from physical contact with your client. Although this is a very stressful time for them, give them hugs, holding their hands, putting your arm around them to comfort them is not a good idea. Okay. I know that's your natural instinct. You're caring people, but that is not a good idea right now. You do have some clients that you do need to have physical contact with. You're providing personal care for them. You're helping them in the shower. You're helping them get dressed, helping them into the bathroom, all those things. And you have to have physical contact. In those situations, always, 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 always have gloves on. Another thing that you can do is you need to practice sheltering in place when you're not at work. You need to encourage your family members, those you come in contact with, to do the same. The more social distancing, the more self-isolation when not working we practice, the better chance we have to flatten the curve and the better chance we have of not spreading this to our clients and to our coworkers. Again, if you become ill, call the office. If a family member is diagnosed with COVID-19, call the office. If you're exposed by someone else, call the office. If a client is sick or a client's family member is sick, call the office. Please don't hesitate. If you have any questions about it, call the office. We are here to help you. We're here to answer your questions. There are going to be a few changes. Starting on Monday, the office will be open from 8 to 4, Monday through Friday. If you come to the office, you're going to find the front door locked. What we're asking you to do is to call us ahead of time. Let us know you're coming. Even if it's in the parking lot. You sit out in the parking lot, you say, hey, Lonnie, I'm out in the parking lot. I'm coming in to get a box of gloves. Great. We'll get what you need ready. We'll meet you at the door and make sure that you have what you need. We're doing this again because of social distancing. We don't want to get sick. We don't want to get you to get sick. And again, we're practicing to flatten the curve. Unfortunately, the masks and disinfectant wipes we were expecting this week that I told you about have not arrived. We're trying to get an arrival date on those. We do know that a lot of these medical supplies are very short supplied. We do have gloves, and you can pick those up. We will let you know when the masks, when the disinfectants, anything like that do come in. We will send out a text to let you know they are here. We are diligently working trying to get them here. If your clients need supplies, let us know. If they need toilet paper, they need food, they need groceries, please let us know. Both the City of Columbus and the Area Office on Aging have set up hotlines that we can call to have food delivered to our clients, or if it's something small, we can get it ourselves. But please don't hesitate. Check their cupboards. Ask them if they need anything when you go in. They may not ask you or tell you because, as a general rule, they don't like to say things like that. So make sure that you ask them and check. In addition to the temporary bonuses we're providing for you, we truly want to let you know, we truly want to let you know how much we care. And if you need anything, please don't hesitate. Don't be embarrassed. Call us. We have started a small food bank here in the office. If anyone needs a few items, it is not Mid-Ohio Food Bank by any means, but we do have some supplies that you can use in the short term. And unfortunately, no toilet paper or cleaning supplies. We're looking for those just like everybody else. But we are here for you. We don't want you to hesitate. We want you to call. If we can't help you with something, we will try to find a resource that can help you. This is an unprecedented time for all of us. Many of us are going through some very difficult times, and the only way we're going to get through this is to work together as a community. Please call us with any questions, any concerns. We truly appreciate your commitment to Visiting Angels, your commitment to your clients. And know that I can speak for everyone here in the office and Bill and myself, how much we appreciate it and how much we're thinking of you and how much we are praying for all of it, for everyone, you, your family members, and our clients. Please keep communications open, talk to us, find out information, and if you need help, if your clients need help, please call us immediately. We hope you have a very good weekend. And stay safe, stay healthy, and let us know if there's anything that we can do. Thank you.